Hello, and welcome to NAFDAC and Your Health. On this program, we bring you NAFDAC's activities in fulfilling its mandate of safeguarding the health of the nation. My name is Amanda Ugu. On NAFDAC and Your Health today, our first feature will be on the efforts of NAFDAC to further step up its game on ensuring drug safety. The agency's regulatory efforts at ensuring drugs are produced and stored under ideal conditions and according to stipulated regulatory guidelines that will ultimately guarantee that they get to their users in good conditions. We will also intimate you on the agency's recent enforcement activity in Onitsha that exposed a pharmaceutical company where drugs were not only manufactured under an utterly poor condition, but unapproved drugs were also manufactured before NAFDAC descended on the production site. Drugs are to keep the human body healthy and maximally functional, and when illnesses set in, drugs are to be taken to return the body to its healthy state. However, to ensure that drugs possess and sustain the efficacy that make them perform their due functions and that they do not rather compound the illnesses that they are supposed to cure, drugs must be produced under ideal conditions and stored in conditions that will prevent them from losing their potency. It should also be ensured that no unintended reactions occur when drugs are taken. All regulatory efforts of NAFDAC to ensure all this happen are embodied in NAFDAC's concerted efforts at ensuring drug safety.
To get to maturity level 3, NAFDAC was benchmarked, audited for 8 functions. One of the 8 functions is regulatory inspection. Drug facility inspection. Why is drug facility inspection so important? It is extremely important because if a company is not following good manufacturing practices, the product will very likely be compromised and it can endanger public health. What are good manufacturing practices? They are practices that are of international standards that cover from the restroom or the toilet of a company to even the office of the manager, where they do documentation or keep records, to the manufacturing facility itself, the floor, to the laboratories, to the warehouse. These good manufacturing practices cover a lot because if you walk through a drug facility, you can easily know what the product is going to be like. Let's start with the receiving section. If I get to a company and they have bags of raw materials on the floor, not on the pallet, not away from the floor, very likely the product of that company is not going to be good. Why? Because when you store things on the floor, and these are not things you just keep on the floor for one day and then move. First of all, you're not supposed to put them on the bare floor. Now these products of materials stay there for a while. The floor will be breathing into it, moisture. So when you mix moisture and the temperature in the room, if it is high, you break down the product fast. And what you put into a product, meaning the ingredients, whether it is active ingredients, the drug, or the non-active ingredients, the excipients, what you put into the product is what you get. So even as simple as the warehouse or the receiving section of a company, it must be of international standard. Now you move into even the placement of the toilet and the floor. They cannot be that close because the likelihood of contamination will be there. So that is, it may look innocuous or not so important, but it's extremely important. If it is a day-to-day thing, somebody runs into the toilet and then come and start touching tablets or touching machine, it can endanger people's health because of contamination. Now you go to the floor itself. What is the environment? if the environment is not clean, very likely the product is going to be bad. Because it is from little things that you take quality away or you add quality into the process or the product. Do they have standard operation procedure for everything they are doing? Do they have standard operation procedure? Do they have record of the machine performance? Meaning this machine has been running, for 24 hours. We have data in terms of how many tablets per minute. Do we do in-process testing? Is the tablet too soft at a particular time during the processing, or too hard, or it is according to specification? All these things are what are called in-process testing.
The activities of NAFDAC regarding drug safety took a new dimension after the global benchmarking that gave NAFDAC the Maturity Level 3 qualification, and this in turn had a great positive impact on the Nigerian pharmaceutical industry.
When we did our good manufacturing practice roadmap about 3+ years ago, we saw varied levels of compliance to GMP. We then categorized the companies: low risk, medium risk, high risk. For the high risk, we gave them the CAPA, the things to correct, that we will be visiting them every 6 months. For the medium risk, we gave them the CAPA, that we will be visiting them every year. So after they have addressed, they will have addressed our CAPA, because there is the CAPA inspection. You have to be different from routine inspection. Then for the low risk, we also gave them their CAPA. We'll be visiting you every 2 years, because you are doing so well. We don't need to. You have put things in place. What we also found, and we use international standards, UNIDO, WHO standards. So it's not something that we created on our own. What we found out is that those that have high risk, that we gave CAPA to, and that we were monitoring, there were about 6 of them that didn't even attempt. We shut them down completely. The ones that have high risk, again, that really want to do good business, some of them said, it's better to leave my old facility and build a new one, because to start changing the old, it may be costlier than building a new one. So good things are happening in terms of the manufacturers in Nigeria.
The program continues after the short break. Stay with us.
Beware. Fake or damaged drugs have put many people in serious health harms and have killed many others. But you can protect yourself by seeking professional healthcare advice when you feel unwell. Buy drugs from only licensed pharmaceutical outlets and make sure you check the packaging for poor condition, spelling errors, and unclear labelings. Also, check NAFDAC registration number, batch number, the expiry date, manufacture date, and manufacturer's address before paying, and always collect a receipt. If you suspect a drug to be fake or damaged, report immediately to NAFDAC on 0800-162-3322 or send an email to sf.alert@nafdac.gov.ng. Protect yourself and your loved ones. This message is brought to you by NAFDAC with support from WHO.
Welcome back. You are still watching NAFDAC and your health. In the drive to continually monitor and ensure that only wholesome drugs are produced and made available to the Nigerian market, the Investigation and Enforcement Directorate of NAFDAC, in its characteristic manner, recently clamped down on Damazol Pharmaceutical Company in Onitsha, where it was clearly evident through the act put up that the manufacturing of drugs going on within the premises of the company were immersed in suspicion.
The essence of this kind of visit is to ensure that the company is producing and still meet up with the good manufacturing practice under which the products were registered. So that is why we normally schedule routine inspections that are unannounced to these facilities so that we meet them at their natural state. But unfortunately, and to our surprise, a company that has a marketing authorization prevented our staff from gaining access to the facility to carry out their scheduled inspection. They refused to open the gate for the officers. After so many hours of discussing through the openings of the gate with the people inside, including the superintendent pharmacist who was inside the factory, they refused to open the facility for them to carry out their routine visit. So the officers had to leave. They had to leave. And this was what warranted management, the DG, NAFDAC, to direct that Investigation and Enforcement Directorate should immediately pay visit to the place. And we had to go because the action of this company is very suspicious. They must be hiding something for them to have resisted the officers from carrying out their scheduled, unannounced routine inspection of the facility. So when Investigation and Enforcement Directorate got there, normally when we go out with our police because we have policemen that are attached to us. So on getting to the facility, we still met the same resistance. They prevented us from gaining access into the facility. So we didn't have any option than to carry out the normal way we treat such class of people. We had to scale the fence. We scaled the gate to gain access into the facility. So on getting into the facility, surprisingly to us, we actually found out that actually this company has reasons for preventing us from accessing the facility. On getting into the premises, the production pharmacist went to hide in one of the rooms. We had to look around before we were able to fish him out from where he went to hide. So when he eventually came out, we asked him to take us through the facility, especially the production area and the raw material store and the finished product store. So on getting to the production area, there were a lot of revelation, awful revelation. We found out that the facilities which were approved for them to use for production, they were not using those facilities. The mixing tanks, the stainless steel mixing tanks, which were used when we went there for the normal inspections, they abandoned them. They were now using mixing syrup because what the company produces are children products, syrups. Basically, the ones we made them producing was Damazole paracetamol syrup and Damazole metronidazole syrup. These are children products. And the condition under which they were producing it, they were mixing these products manually in plastic buckets using manual stirrers to mix these products. Aside from that, in filling, the filling was done manually from taps. And the environment under which they were producing it, there was no air control of any sort. The windows were open, not screened. There were no air conditioning system, not to talk of HVAC, not even ordinary air conditioning system. All those things were there, but they were not in use. The doors and windows were left open under the vagaries of the environment. That means the environment, one can actually know the amount of the microbial load of those environments, which can adversely impact on the product which they are producing. The product is wide open for contamination. They were filling manually, and the staff were not properly cladded in requisite apparel. Their face masks were not there. They didn't have hand gloves. The overall were not there. And the ventilation was only aided by ceiling fan, which is not supposed to be. It will be in a production area. So, and we also found out that aside from this production area, where they have another production area, which is at the back of the premises, where they have a registered product, is by the MD's house, because MD's house is behind the factory premises. They have a batcher site of kind of attachment to the MD's house. That batcher is made up of zinc. It is constructed with zinc, about 4 rooms, and these rooms is very close to the bush area, open to the bush. It's just batcher grid with zinc. You see, we've also found evidence that they were mixing products from there, which after mixing from there, they now move to the factory where they fill manually. So it was a terrible situation, and the GMP was terribly, terribly bad. So we didn't have any option than to seal the place up and arrested the superintendent pharmacists. They were detained, including the superintendent pharmacist and the MD of the factory. For aside from the GMP aspect of this, NAFDAC does not condone in any way resistance, obstruction. They will be prosecuted for obstruction because nobody obstructs NAFDAC activities and goes scot-free. We will not take that. So they will be charged to court for obstruction before we now deal with the issue of poor GMP. The factory is sealed by now. Before we seal the place up, we evacuated all those products which were produced that were on ground. We evacuated everything. That's paracetamol syrup, Damazo paracetamol syrup, and Damazo metronidazole syrup. They were evacuated because the products have been sampled and sent to the laboratory because we need to find out the integrity and the quality of the products which they have produced. So the products have been sampled against the superintendent pharmacist and the owner of the facility, and it has been sent to the laboratory for analysis.
Many more who are recalcitrant and are not willing to change, are not willing to improve their quality systems, are not willing to ensure that drugs that meet quality requirements are manufactured consistently. Such manufacturers definitely will be closed, and many more of them will be closed. So I'm appealing to Nigerians, please help us. If in your neighborhood you find a manufacturer producing drugs under unhealthy conditions, please report to the nearest NAFDAC office and be sure that we are going to take action. We are hoping that more of our manufacturers will meet the WHO GMP requirements and will meet drugs that will protect every one of us.
NAFDAC seizes 296 cartons of imported analgin injections imported from China through unauthorized seaport. The National Agency for Food and Drug Administration and Control, NAFDAC, has taken custody of 296 cartons of banned analgin injections that were imported into the country from China through unauthorized seaport. Speaking during the handover ceremony, the Public Relations Officer of the Nigerian Customs Area 2 Command, Mr. B.O. Lumber, said that the analgin injections loaded into 296 cartons were discovered following intelligence gathering that led to the thorough search of the cartons that were promptly put on hold while NAFDAC was invited for further checks. The NAFDAC Deputy Director in charge of Ports Inspection in Rivers State, Mr. Tony Ragbe, while receiving the product, conveyed the appreciation of the Director General to Customs Controller Area 2 Command, Honor. He described the interception as a nefarious act by unscrupulous businessmen who have no regard for public health, adding that the importation of the fake injections was not authorized by NAFDAC. According to the Port Inspection Deputy Director, the injections could have caused colossal damage if they were allowed into the pharmaceutical market. He went on to explain that one of the packs contains packs of 5 ml of analgin, a product that has been banned for over 16 years in Nigeria and many other countries of the world. He, on behalf of Director General of NAFDAC, Professor Christiana Adeyeye, commended the Honor Customs Command for being proactive, adding that the fight against fake, substandard, and falsified medicines is a battle that needed the cooperation of all well-meaning Nigerians. NAFDAC hits hard on bakeries, water production factories for flouting regulatory guidelines in Kaduna, sanctions 16. In line with its statutory mandate, the National Agency for Food and Drug Administration and Control, NAFDAC, in Kaduna has stepped up surveillance on manufacturing facilities of regulated products in the state, with a view to ascertaining their compliance to standards and regulations. Surveillance and routine inspection visits on establishments are fundamentally some of the regular activities embarked upon by NAFDAC, with a view to assessing good manufacturing practice, GMP, as well as compliance to sanitary and phytosanitary guidelines to guarantee quality, safety, and wholesomeness. During the visits, various degrees of sanctions were meted out on the defaulting establishments, which include 7 bakeries and 9 water facilities, to serve as deterrents. NAFDAC will continue to live up to its responsibility to ensure the safety of the consumer always. That was NAFDAC Update. You have been updated.
That has been our package on this edition of the program. Do join us again, same time, same station, for another informative package. We are always ready to receive your comments and complaints on any activity concerning fake drugs or adulterated food products.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Importing, producing, distributing, and selling fake drugs and adulterated food products are criminal offenses, and they put our lives at risk. Join the drive to safeguard the health of the nation by reporting any suspicious activity in your area to NAFDAC. Till we come your way again next week, stay safe.